everyone, and welcome to the Sania Farooqui show. Today, we have somebody joining in from Somalia. She is Dr. Deqo Mohamed, a Somalia-born obstetrician-gynecologist and founder of the Hagarla Institute and co-founder of the Somali Cancer Society. The Hagarla Institute focuses on capacity building, medical research, data collection, and training of medical personnel in Somalia and other African countries. Dr. Mohamed works full-time on the ground in Somalia and leads project on maternal health nationwide. She leads the National Call Center for COVID-19 Follow-up Doctors Department and is also part of the Somali National Task Force for COVID-19 in 2020. Dr. Mohamed is the president of the Dr. Hawa Abdi Foundation in USA. Dr. Mohamed also worked with Doctors Without Borders in 2008 to 2010 in Somalia. Thank you so much, Dr. Deqo. It is wonderful to have you on the Sania Farooqui show today.
Thank you for having me.
So, I want to begin by asking, tell us how Dr. Hawa Abdi Foundation started. It was started by your mother in 1983, and it's been a driving force for helping refugees in Somalia since 1983. So just take us through that.
My mom started an Hawa Abdi Foundation. Actually, in the beginning, it was the Rural Health Development Organization. So her goal was, her mother died giving a birth, and she became a doctor, gynecologist. Her goal was make sure every mothers have a delivery, access to health, clean delivery and safe delivery. So that's why she started as a rural health development in 1983 all the way to 1991. Then 1991, when the civil war started, she has to do more than healthcare. So she has to make sure she provided the shelter, the food, a lot of international organizations were trusting her, like WFP, ICRC was working with her. So we had to transition just to being a rural health development and organization that covers everything. So that's why it's started Dr. Hawa Abdi Foundation. And officially we registered and launched in US in 2010 when we received the award Glamour Woman of the Year. Then a lot of, outcry, people want to help, and it's like, none of us are physicians, all of us are physicians, none of us had a background of running non-profit world. It's like, we don't have the time. I remember when the first time they called me, it's like, you need to do this Glamour magazine. It's like, oh no, I'm in a surgery. Sorry, I don't even understand what Glamour magazine is. So that's how the journey took off. But last 10 years, I think it was a blessing, me being last 14 years on the ground working with it. It gives us an opportunity to expand our work and to do more efficient.
Yeah, and you've gone ahead and expanded it even more by also starting the Hagarla Institute. So what kind of work do you do over there?
Hagarla Institute is my frustration. That's what I explain to the people for being in Somalia and born in Africa and not having effective research, not having effective capacity building. Somali's healthcare is run for last 30 years by international NGOs. And basically what they do, they come in a short window. I really witnessed when I work in MSF, one of the best international NGOs, but still doesn't have the time to teach the health personnel more deeply, more effectively, leaving something behind. So every organization comes in, teaches very shallow level. Then we develop this massive of healthcare workers who have not enough sufficient capacity or knowledge, but calling themselves doctors, nurses. So, and the malpractice they do, that's what I have seen in my emergency room. So I was like, we have to figure out what to do. So that's the main thing was capacity building and of course the research. There's no data in Somalia. That's another frustration. If you try to Google anything in any level, in any capacity, you see maybe small numbers from UNICEF or WHO like 2003 or 1991. So, and there is a huge gap of 10, 20 years. There's no data done. So that's another thing we want to do it and really it become a platform more academic where we were missing a lot of things. So I'm very lucky to add that section into the work we're doing.
Yeah. So, you're second generation doctor in your family. What inspired you to take it up as a profession? Is it very common for women in Somalia to take it up? Or is it very difficult? Did you have to go through a lot of challenges as a woman and also as a Muslim woman to become a doctor?
Absolutely. There's 100 challenges, but I'm lucky I had a very strong parents. And as an African child, my destiny was set up. So when I was a teenager, I never wanted to become a doctor. I was like historian or writing or academia, what I was very passionate about. It maybe becoming a professor. But my mom, no, no, no. I'm building a hospital. We need a doctors. So,
Mhm.
and really, I was struggling as a teenager. My mom was in the university teaching. I didn't want her to be her student. She was a tough professor. Then Civil War happened. When Civil War happened, I have seen in the first hand. So I had to deliver when I was 15, not even having a medical background, nothing. So I just had to watch this woman while my mom and nursing are doing the surgery, and she just delivered, and I had to just assist her to deliver while I was screaming. So I really felt the need of the capacity is missing. There's not enough medical professionals, and at the same time, I could have discussion with my patients. My history, my love of discussion with the people and listening people. It came from there. It's like, okay, I can find my passion within the medicine, and my curiosity might be in the research in medicine. So that's what my journey. I think literally, if Civil War never happened, I would be struggling to become a doctor. But I think Civil War in Somalia just opened me a door and allow me to think about it. I would be more impactful being a doctor than being a professor where the schools were closed. So what I will do in the middle of Civil War.
Yeah, yeah. I want to know a little about your mother as well. What was it like growing up watching such a fantastic, powerful, and a dedicated woman? She was also nominated for the Nobel Peace Prize with many more prestigious awards. So, yeah, tell us about her and what was the kind of impact that she had on you?
Uh, it was amazing in one hand, and in other hand, it was very tough because everything you do, it's not enough for her. She set a very high standard. Wherever you do, it's like you have everything. You have the parents, you have a roof in your head. We are feeding you. I grew up in this environment. So it's very, very tough. But in the same time, it's very, very inspiring the way she negotiated with elderly, the way she stood up as a woman, the way she taught us like your femininity or being woman should not hold you back, because we're in a society where as you woman you were undermined. I remember when my parents were sending me at age of 16 going 17 to the college, all my neighbors, everyone was like, it's the time to give her marriage and not to send a college. So your daughter will come all, and she will not have a marriage. You never know what's going to happen when she sent somewhere. So she really fought hard for all these weak cultures, habits and cultures and things that holds women back. And she's like, nope. And I think her character and her drive and ambition came because they were a family of four girls. They never had a brother. So they developed this very strong female character that really have the excellent skills of negotiating with a man and understanding the culture of Somalia. So I think that's what I learned, and that's what I try to implement in daily work of my life.
Mhm. About growing up amidst refugee camps, witnessing ground realities about poverty, lack of healthcare, and every existential crisis. Tell me about your childhood and how that has impacted your life today, and made you who you are. Like you said, if the civil war had not taken place, you would have not become a doctor today.
No, in the beginning of my childhood was this little clinic outside of the city where my mom started rural health development. So my frustration was very young child, like why we are leaving the city. I couldn't understand why we move in rural health, and it was only our father who family and people my mom helped, so that I have flexibility. I could go to the school, then I reached the high school. Then suddenly, as a teenager, when your life is starting to flourish, you become a refugee camp. So we are taking all my mom's patients, everyone, friends. I'm losing my bedroom, my bed, my everything. My room becomes a whole family's house. So, the cousins and uncles and everything there. So it was really frustrating, and being in completely shift of your life overnight. Overnight, my mom tells you, you need to wake up early morning. You need to make sure everyone's fed. It's my character, my attitude, and my job changed overnight. It's like you cannot have any attitude. You just listen, you work, and you serve. And I think for being a humanitarian embedded for me a very early age, which sometimes I wish I could stop. Sometimes as young age, I got used to it, serving and helping people. Sometimes like, okay, I don't need to do that. So it becomes your daily habit, which gives you bad side effects. But otherwise, I'm very happy to be in that environment because it taught me to appreciate what I have. I wouldn't be appreciating, having wonderful parents, having a house, and having, a future set up for me where hundreds of thousands of girls never had it. So they never finished the high school, they never went to college. I got an amazing opportunity, and I'm grateful for being my parents.
So what is the current estimation of the refugees living in the camps in Somalia right now, where you are working? What are the challenges that the camps are facing today, as of now, with the pandemic going on?
I don't think so. Now in Somalia, it's getting much better. The condition, the civil war is moving out. It's getting much better. But the numbers in IDP camps, internally displaced people and refugees, basically most of Somalia is internally displaced and outside of Somalia. Those people are in the city of Mogadishu, where I'm now. I'm focusing in their humanitarian help. It's almost counted 800,000, so almost a little bit under one, around the city and outside of the city. So that's the numbers. Still, there's a lot of displaced people who don't have houses. They don't know their future, or maybe they sold because they're displaced because of the war. So it's getting better. The government is focusing how they finding a whole department. We are trying to transition. In our camp, we just basically transitioned everyone. We help them to resettle and find a space. Now we provide on healthcare services and the water and everything. So we closed that IDP camps we were running so long, because one thing we discovered for last 30 years, we creating dependency. So those people are become only dependent on us and our foundation, and being in this heaven, they're not willing to move on. They're not willing to find a jobs or find a place where they call themselves. They just want to stay there and get fed and sleep and nothing. So I think to break that, we need to demolish all these IDP camps and find a transitional homes, what we call. Let them have these homes. Maybe it's free. Maybe they can contribute some of their income. But that's what we are planning to do. And having 30 years in a camp and third generation was like, it become really things that pulls all 3 million people that who's internally displaced over all the country become dependent on international NGOs. So I think it's a disaster. I believe age supposed to be in a certain time and certain years, but if age passes 30 years, where a young parents they were refugee and now they're parents, they're 30 years old. Can you imagine? Now they're having their own children, but they have nothing to tell their own children except to be in IDPs. So they never had a normal life, and never had a house or income or job. So that's very important to have a discussion and break it. So that's the situation IDPs in Somalia.
Yeah. You work a lot on maternal health as well. Can you talk a little about the status of women when it comes to, what are the challenges that they are facing when it comes to healthcare during the pandemic, during the lockdown, in terms of also how are they sustaining through with or without, provision to healthcare around them?
Um, Somalia is the second worst in maternal mortality rate, only South Sudan. So that tells you something. When you have the highest in maternal mortality in the world, second highest. A lot of things we're doing since 2019. The reason I have a Hagarla is to figure out really what is the exactly the root cause of these issues. Is this a lack of skills? Is a lack of access to healthcare? What is the problem? And what we have seen, we're compiling now 2 years data, and I hope we can publish somewhere next year. We seen every day is also culture contributes a huge number of that maternal mortality death. So because they send the hospitals last minute, they think hospital is the death place. They don't go. They trust more. The several surveys we did, they trust almost in over 90%. They trust traditional healing than medical doctor. So Western medicine and traditional medicine. So I think one of the reason I hope we can start working is how we can combine this traditional healing and Western healing together, how we can build trust so we can gain the trust of the mothers. So if we keep insisting and saying, oh, everyone is wrong, we're right because we learn from West. I know how to say if I'm obstetrician, I have this, I do. If we keep doing this attitude, we keep losing people. So I think we need to be more humble and understand the culture and say, okay, we will make a step, we come to over to you. You need to come toward to us. So then I think that's what I'm thinking to do in my next 2 3 years to focus to create a program where we can combine this. And also, you have to make sure the traditional birth attendance is delivered in 70% of Somali mothers. They don't get skilled birth. So 30% only are midwives delivering. The 70%, you can tell how huge is the gap, are delivering grandmothers who deliver their grandchildren. So they trust that grandmother than me, who's obstetrician with 20 years experience. They will say, no, I don't know you because this mother delivered my mother. I know she delivered. And I think we need to find or educate them, those TBS, traditional birth attendants, or have a adjacent co-facilitated, like I can work with 10 of them, me obstetrician, I can help them if they have a problem. So that's one of the solutions we're looking, but the problem is huge. And unless Somali government steps in, which is too far now, they're all busy with security and security issues. They have no time for help or any development. But I think in the future, the government has to step in.
How many patients seek help in the hospital every day? What are the kind of cases that are coming in, and how difficult it is to treat the number of patients with limited manpower during the times of a pandemic, especially?
It's exhausted, but pandemic it really slowed our numbers of patients because we are not dealing COVID-19 patients. We're sending any COVID symptoms to the central hospital that deals with COVID. We usually see minimum 20, maximum 200, depending of the day, of the season, malaria outbreak or a pneumonia outbreak. So it fluctuates extremely. Ramadan is next month. It's a slow. Only the deliveries and emergencies cases come. So it's a seasonal. So average we see minimum 20, maximum 150. So that's what we have annually. I mean daily visits. So we do have several clinics in the community. We open mobile clinic. We have two different community centers. Those are seeing average of 15, 20. They're very new. They're in their community also. So I think overall, we're opening fourth clinic now. So we want to expand hospitals and accessibility of health, clean delivery and safe delivery to the village.
Yeah. And how are these issues being addressed by the government? Has the government been supportive? How have they been dealing with managing COVID-19? Is the burden on private individuals like you who are running medical camps, or are government hospitals also functioning with in the same manner as you are?
It's a difficult. I run. I The good thing we created a national call center, which helped a lot last year to reduce the effect of COVID-19 because we have population, a very young population. Somalia over 75 is under 30. So I mean under 40. So you can see the majority of society is very young. So they were able to recover from COVID-19. So one of the big thing we did, I worked last year is the COVID to make sure young people with the sign and symptoms of COVID, if they're not severe, to stay home. So the few elderly, which is less than 3% who are with comorbidity, all those are we were emptying for the beds to become. We didn't have ventilators. We were not ready. When the COVID hit last year, we had only 19 beds. And by the time we finished first wave, we have over 50 ICU beds. The good thing in Somalia, it has been several famine and several, disasters and the war. People or the government or non-profit organizations, international, nationals, are set up a mechanism where they can quickly react an emergency. So they set up one hospital very quickly. We had that was not enough. Private sectors were also serving a community because 90% of healthcare in Somalia are run by private sectors. So the government only runs 3 hospitals. You can imagine Mogadishu, we have 4 million people, 3 hospitals they run. Without, they don't even they cannot cover the supplies or medication. It's just the beds and some services. So this year, second wave of COVID was much harder than last year. So the death toll this year, this second wave was much higher. What we lost the whole last year, we lost this year 1 month. So last February, we lost 120 people. That's the number we lost last year, whole year, COVID in the first wave. So it was much harder. Now it's in the rural area and different states. But we pushed the private sector to have the COVID hospitals. 2 private hospitals who were well equipped, they came in. So we built a private public health sector relationship to help COVID response. But it's not easy. The government is not set up. They want to do a lot. They want to help. We communicate every day, but their capacity is very limited. They don't have funding. Allocation of funds to the government to the healthcare is very limited. It's very, very small. So basically, they cannot run their own hospitals. Forget about supporting others. So that's the situation Somalia in healthcare.
Okay, on that note, we're going to wrap up, but I have my last question for you, Dr. Deqo. Moving forward, what is your dream for the people of Somalia? You've been working in the humanitarian and the healthcare sector for years. What is it that you wish to achieve through your work, and how do you plan to carry your mother's legacy as well?
Oh, that's a big question. I have a lot of dreams, but in the same time, being in Somalia and working in this environment, I learned to be realistic. I will be happy to leave behind if I have a system or an institution that continues the work my mother started, or expanding or leaving behind skilled people. One thing I learned in my work is that money can come and go, but if you have a people in a place who have the skills and knowledge and a moral compass, things will be fine. You can gain the money, you can expand. So I think I'm putting my energy and my resources and everything to have the best people in the place because the country was brain drained. Our country lost 2 generations because of civil war. So I think that's what we're missing. That's the first thing. I cannot solve all the issues in the ground. It needs centuries to come, or even maybe another 30 years to fix something. But I think we have the best opportunity in Somalia to leapfrog all the health issues around the world. So we have if we learn and do the right way, and learn from the mistakes of others, we can just leapfrog and have the best healthcare system within short.
So, it's really great. I'm so glad that we were able to have this conversation, and good luck with all the amazing work that you're doing. And it's wonderful to also see you be so motivated and dedicated to the humanitarian and the healthcare system in the country. So good luck with that. And thank you so much for coming on the Sania Farooqui show today.
Thank you for having me. Have a wonderful day.
You too. On that note, I'm going to wrap up. Thank you so much for watching, all of you who have joined in. I hope that you will subscribe to our YouTube channel and follow us on Facebook, on Twitter, on Instagram, and also Spotify. And do sign up for our newsletter for all the updates on the Sania Farooqui Show. Thank you so much for watching. I'll see you again next week.